Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it. Welcome to today's podcast. We are so excited about this topic because I actually did a story the other day when I was on call asking for questions around cesarean sections, and we got
So many.
ton and some really good ones as well.
Yeah.
So we thought we would do a podcast on kind of cesarean sections. You asked, we answered. So we hope you enjoy it. And certainly if you have any questions that come up from this, feel free to reach out to us. Shoot us an email at shefoundhealth@gmail.com or send us a question on Instagram, she.found.motherhood.
I took a screenshot of all the questions that people asked in our Q&A. I think we have 4 pages of questions. So what we thought we would do is answer the most common or the most frequently asked C-section questions. And one of the first ones we get is, how long after cesarean section should I wait for a second pregnancy?
So this all depends on what your goals are for the subsequent delivery. So if you've had a single cesarean section and you're hoping to try for a TOLAC, so a trial of labor after cesarean, to try for vaginal delivery, then the recommendation is that it's at least 18 months from your C-section to the next delivery. So realistically, just in case you have a preterm labor, you may want to put it out an extra month or so about 19 months. And that's just to make sure that your scar is properly healed. But if you are hoping to have a repeat elective cesarean section, so if you're hoping for a second C-section, then the timing is less of an issue. Obviously, you want to let your body heal from your cesarean section. It is a major surgery, and I think we often don't really recognize that, those of us who have them do in the first few weeks, but it's hard on your body, and it takes a ton of time to heal. We know that most surgeries, really, you can expect healing to go for a year afterwards.
So minimum 6 months.
Yeah. So adding that stress of a new pregnancy to your body can be challenging. However, for some people, they're getting on, I was going to say in their elderly years, elderly in the world of pregnancy.
Yeah.
You know, if you're in your late 30s, your fertility might be declining, then you may want to move forward a little bit sooner. But so ideally, at least 18 to 19 months from one delivery to the next, if you're hoping to trial for a vaginal delivery, and it matters a little bit less if you're just planning on having another repeat cesarean section.
Yeah. And I think it's really important to understand the reasoning behind that. And it is that there's a scar not just on the skin on your abdomen, but there's also a scar on the uterus itself, right? The uterus, we do have to cut into the uterus with a scalpel. And so it's really important that scar on your uterus is strong, because the lower half of that uterus stretches and grows during pregnancy, so it becomes thinner, and then it has to sustain the frequent recurrent contractions through labor, right? So it's more about the safety, the strength, and the integrity of the scar on your uterus, because we sometimes forget that scarring happens on the inside as well as the outside.
Yeah, for sure. And in some communities, I found this out from a colleague who's come from Calgary. They actually do scar assessments if you're hoping for trial of labor after cesarean
Like with
section.
ultrasound?
Yeah, we don't do that here, but in some communities they do, because sometimes you can see that scar is just there very thin. And so then I guess a trial of delivery, vaginal delivery, wouldn't be recommended in those people. In our community in Victoria, we certainly don't do those, but some communities do. So that may be something you want to look into. And certainly if you're trying to decide whether you want to try for a trial of labor after cesarean section versus a repeat elective, we have a whole podcast on kind of risks and benefits of both. How do you make a decision? So check that out. We will make sure we link it in the show notes below.
Yeah. And that sort of leads into the next question, and we won't go into it in significant detail because we do have a podcast around it. But the question is, how do I know if an elective repeat is the best choice? Should I trial of labor? What's the best option for me? And I would say listen to our podcast. Number one. But number two is if you've had a C-section because you had a placenta previa, which is that low-lying placenta that's not safe for labor, or a breech baby, or you didn't labor, then you have the same chances of having a vaginal birth as somebody who's never had a cesarean section before. But if you've labored and your cervix didn't dilate or the baby wouldn't come down, then there is an increased chance that may happen again, but it's not always the case. And so listen to our podcast and have a consultation with a local OBGYN that can examine you, examine your baby, look at your surgical records from your previous cesarean section, and really give you informed information about how to make the best choice.
Yeah, we have access to some great calculators that put in how big was your baby and were they properly positioned or not, and your age and all of those types of things that can give us a bit better of a prediction tool. Nothing is perfect, obviously, but that is certainly one of them. And the other thing I always say is, what does your gut tell you? What does your inner being tell you? And if some people just really want to try for vaginal delivery for whatever reason is important to them, other people aren't too fussed either way as long as they have a healthy baby. Some people really like the planning idea of having an elective cesarean section. My viewpoint was, why ruin 2 holes? But but I ruined this second hole was my C-section, so it went backwards there. But everybody's different, right? So, and I say that a bit facetiously, it's funny, but in fact, there are consequences to vaginal delivery as well in terms of long-term continence and issues with urinary things. And you have to take in both sides of the equation when you're making these decisions.
Yeah. And it's an individualized choice, right?
Yeah.
All birth is natural.
Yeah.
That's our stance.
It's your birth, your decision.
Another question we get is it common for first-time moms or pregnant people to require cesarean birth? And statistically speaking, the number that we quote is generally about 30%.
So
right?
There's a 30% cesarean section rate.
Yeah.
Full stop.
Yes.
Some of those are repeat cesarean sections.
Yes.
Some of those are for medical indications, such as placenta previa, breech in some cases. You've had a previous surgery on your uterus. There's reasons that we would recommend mono twins. There's medical reasons that we would recommend a
That
cesarean
means
section.
2 twins, 1 balloon to swim in.
Correct. 1 placenta, 1 balloon. 2 twins sharing the same bedroom in the same condo. If you listen to our twins podcast.
That's good.
And so if you take out all of those numbers, I'm guesstimating it's probably about a 20% risk
I would say.
going into a planned labor. So you're hoping for a vaginal delivery. About 1 in 5 people probably end up with a cesarean section. And we also have a great podcast on the top 5 reasons for cesarean sections.
I know. We have so many podcasts.
We really do. So we'll link those below. The twins one, if you are pregnant with twins and wondering, and the top 5 reasons for a cesarean section. But certainly it depends on the reasons that cesarean sections are done. But if you're going into a labor, if you're planning on trying for a vaginal delivery and it's your first baby and there's no medical reasons that you should be getting a cesarean section or that it's being recommended, it's about a 1 in 5-ish chance that you would end up having a cesarean section. 80% chance you won't.
Exactly. I love when people flip numbers around. And so I think that's why I'm going to promote something else that we have out there is it's really important to understand birth preferences and when you wouldn't accept something. Because if you're laboring and things start moving in a direction that perhaps you hadn't planned, if you have at least thought about in your mind, when would you accept a cesarean birth? It's something that you can make a better and more informed decision in the moment when you've already thought about what your wishes would be.
Yeah. So we have a great birth preferences mini course that will also link below. And it helps you go through creating that birth plan, talking with your partner or support people, talking with your care provider, so that you can actually think about some of those things that may come up. And if you are curious about that, we also have a great childbirth education course, and we go through natural labor, how people can support you. We talk about different modes of delivery and why things might be indicated or not. We talk about kind of those first few hours with your baby and what to expect in hospital, and the first 3 months of life at home with your newborn.
Honestly way more overwhelming than the birth.
Yeah. And people prepare much less for that. We'll make sure we link that, but it's shefoundhealth.ca/masterclass, and it's about an 8-hour course. It's divided into little snippets. You can watch them anywhere at any time. You can watch them on repeat. We've had people watching them in delivery rooms after they found out that they're recommended to have a C-section or they need to be augmented with oxytocin or a variety of reasons.
And we do an operating room tour.
Yeah, we do an operating room tour.
And I believe Dr. Alicia interviewed some of the key players.
Sure did.
I talked to an OBGYN and an anesthesiologist.
Yeah.
There's a lot of really juicy stuff in there.
Hey, Sarah.
Do you know what I've never asked you? Did you take a prenatal course when you were pregnant?
We did. Even though I'm a maternity care provider, my husband and I thought it would be an important process for us to go through together.
That's so cute. It must have been so hard for you guys to coordinate your busy schedules, though.
Oh, tell me about it. I was a medical resident at the time, and he was working full-time. We really struggled to find a course that would fit our needs and ended up doing a semi-private course that still was challenging to schedule and quite expensive.
Wouldn't it have been nice for you guys to have access to an online course with evidence-based content that you could do from the comfort of your own home or on your own time at your own pace?
You're telling me if I had had access to something like our Pregnancy to Parenthood prenatal masterclass, it would have been a game changer.
And that's the big reason we put this course together, to provide parents with access to a reliable, comprehensive prenatal education from the comfort of their own homes and the ability to watch it and rewatch it when and where they choose.
Plus, it's got so much great information about preparing for the fourth trimester, which I'll admit, I felt really unprepared for. We focus so much on labor and birth when we're pregnant without understanding how challenging breastfeeding in the fourth trimester can be.
I hear ya. And that's why we put together such a comprehensive module all about what to expect for the fourth trimester and for your newborn.
If any of you listeners are pregnant and thinking about a prenatal course, I may be biased, but I would 100% recommend our online course. Head on over to www.shefoundhealth.ca/masterclass to check it out.
We promise you won't be disappointed or your money back.
Okay, we're going to get back to the C-section. We got a few more questions we thought we'd touch on. And this is a really commonly asked question, is what determines the kind of closure used? And so by this, we mean stitches are always on the inside dissolvable. So on the uterus, on the fascia, that really strong connective tissue. But when it comes to the skin, typically there are two options. There is typically a suture that dissolves or staples.
Yeah. So generally speaking, the reason for the cesarean section will influence the type of closure. So if there was an infection in the uterus, so chorioamnionitis, which gave the birthing person a fever or baby's heart rate was going up. So if we suspect that there was an infection involved, then we would typically use staples, simply because as we pull baby out of the uterus, you're pulling them through that skin incision. And so there's a bit of a higher risk of infection of that incision. And so if we use staples, if a little bit gets infected, then that staple can open up rather than the entire, it happens very rarely, guys. Don't get that worried about it. But rather than the entire incision, because you do a dissolvable stitch that you keep going. So it's not individual stitches. It's one stitch all the way. So if it breaks, then it's providing less support. So typically, if you've had an infection around the time of delivery, that's why they would use staples. The other reason for using staples, and this is not something that you have any control over, is it does take a little bit less time. And so if there are other things happening on the ward, again, it doesn't take that much less time. So it's pretty rare that they would do it for this reason. But sometimes if there's another emergency happening and we need to move things forward, we might use staples. People get very scared about staples, but in fact, there's no evidence that it provides any worse healing. The healing looks good. They actually take them out within 3 to 4 days of the incision. And it might be a little bit pinchy to take out, but most people tolerate it super well because that area is often quite numb for a few weeks anyways, because they've cut through the nerves. Most people tolerate staples actually really well. And from a healing point of view, there's no difference in the long term. The only one thing is it's a bit finicky to have them taken out, but it's most people, again, it doesn't bother them.
I know they get a bad rap, but the bonus is because the incision is made horizontally, it follows what we call Langerhans lines. Is that what those are called? Going way back to med school there. It's the natural lines of the skin. So after a couple of days, you actually don't need anything to keep your incision together. Gravity is doing that and your skin's natural sort of desire to be approximated. And so they come out really quickly. And I'm not as up to date on this evidence as I probably was 10 years ago, but theoretically, there's less inflammation because you don't have something in there that needs to be dissolved. The staples are gone. There's no foreign body. So theoretically, your scar could potentially heal better, right? Yeah. Scars heal beautifully, honestly, both ways. But I just feel like people are more afraid of the staples. So there's a little plug if you got staples. Yay for you.
Yeah. And the other thing is, if you're somebody who has keloid scars, so these are scars that are thicker, they're often much darker. Like anytime you scar, you just have a big bump of scar tissue. Make sure that you let your surgeon know because there's certain things that we can do, and you can do actually postpartum in your healing. So things like silicone scar patches, you can order those off Amazon, and you can start those 1 week post.
I think we have those in our Amazon shop.
Yeah, we probably have them in our Amazon shop.
And for my dad, when he had knee replacement surgery, and his scar is beautiful.
Is it?
Yeah.
Should have gotten it for my knees.
Right.
I didn't get a knee replacement, just a tiny little section yet. So there's things that you can do. So if it's something that is a bit of an issue for you, keloid scarring, to talk to your care provider around how you can minimize that chance.
Yeah. And I think probably the last question that we'll talk about today, and probably one of the more controversial, is what are reasons, the question was women, I would say pregnant people, choose cesarean section if it's not medically required. We have a really liberal center, so I think we're really fortunate here that cesarean section is an option for anyone and everyone. But I think it's an important conversation to have.
Mm-hmm. And there's
so many reasons.
And I think those of us who ask these questions are privileged enough not to really have experienced some of the reasons. Some of the reasons that my patients have asked for primary elective C-sections is a history of abuse or sexual assault. And they've been scared that they would get triggered during what should be a really enjoyable time and really one of the most memorable times of their lives. And so, to be honest, some of those, I usually send those people to, usually they're in counseling already, thankfully, but I also send them to talk to the obstetricians, the surgeons around that. And about half of them actually choose to try for vaginal delivery after they have a really good understanding of what that is, and that they will, in the moment, have the power to make a decision to move to cesarean section if they do feel triggered. And I think a lot of it is giving people back that sense of empowerment, which is what we're so pro kind of prenatal education, because you need to feel empowered. So you need to understand, you need to have informed consent around what are the positives and negatives, the risks and benefits of the options out there, so you can make the right choice for you. So I think that's really important.
Yeah. And I think another really common reason is people are really scared to have trauma to their vagina. It's really common to tear during childbirth. I think up to 80% or so of people will have a first or second degree tear, and they often heal wonderfully. People recover well. Pelvic physiotherapy is now much more common than it was even 5-10 years ago. But some pregnant people, some women are really afraid, and it's okay. If it's something you're really worried about, talk to your provider. Oftentimes we can talk to you about things that you can do to prevent the risk of having a complex tear or requiring an episiotomy, like pelvic perineal massage,
which we also have a great free download on. So we'll put that in the show notes below as well.
So much. But if it's something that like you have a deeply seated fear around, then please talk to your provider. You can talk to an obstetrician. And if ultimately you decide that a elective cesarean birth is the right thing for you, then it's the right thing for you, whatever the reason being. Sometimes it's like timing because a partner's in the military and they have to be deployed, and induction is just still so unpredictable. There's so many different reasons people can choose. Every center is going to be a little bit different. But in our center, I've never heard of anyone being declined who really it was their desire and their request, unless they were like actively in labor and a baby was coming out of their vagina and they had asked for an elective cesarean, but they are at a fast labor. And those stories are very uncommon.
Yeah, for sure. So there's a lot of reasons, and everybody's different, right? Some people say that everybody in their family had cesarean section, so they may as well just have a C-section. And again, it's a discussion, right? They may or may not end up that way, but certainly there's all kinds of different reasons. And so just being respectful that people have their own reasons and being curious and compassionate about what those reasons might be. And recognizing that it's none of anybody else's business.
Oh, yeah.
Because if they want to have a cesarean section, then they've obviously got reasons, and we just need to chat around those and then allow them to make a decision that's right for them. But we do know at the same time there's risks to cesarean sections. So there's risk to vaginal birth.
Yeah.
And
just
so,
informed. Your choice should always be informed, right?
Yeah. So there you go. Those are our kind of biggest questions. We got lots more, but we could blether on for hours around this topic. But if you want to learn more, check out our prenatal education course, the masterclass, Pregnancy to Parenthood Masterclass. It got all kinds of information around cesarean sections, as well as vacuum and forceps and vaginal deliveries that are lovely and uncomplicated as well. We also talk about kind of tears and healing process and how to support your perineum.
And have a bonus, right, from Melissa, the Pelvic Floor Project.
Yeah.
Talks about
postpartum recovery. And then we have a bonus from Janette who talks about scar massage, post-cesarean scar massage. So we've got lots of great info in there. It's so good to talk to you guys today.
Yeah.
And we hope that was helpful.
Take care.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.